Well, there's new research that reveals insight into a condition that can cause chest pain called angina with non-obstructive coronary artery disease, or ANOCA. It's a condition that actually can leave doctors stumped.
But there is some good news. Hartford HealthCare is leading the way with a specialized program to support patients diagnosed with ANOCA. And joining us today is Dr. Stephanie Saucier, who is the medical director of the Women's Heart and Wellness Program at Hartford HealthCare. Thank you so much, Doctor, for joining us.
Thank you so much for having me today.
Can you explain what angina with non-obstructive coronary artery disease is, ANOCA, and why it really poses a challenge for doctors?
Absolutely. So we typically call it ANOCA, and ANOCA represents patients who have ongoing episodes of chest pain without a significant blocked artery, one that could be fixed with either stenting or bypass. We know that approximately 50% of people who have undergone angiography or looking at the coronary arteries don't have obstructive disease. However, these patients often suffer from ongoing episodes of chest pain, frequent visits to urgent cares, emergency departments, primary care physicians. And so identifying what the cause is or what type of ANOCA is actually affecting the patient is really important to them.
And doctor, who is at risk for developing ANOCA?
So anyone is technically at risk for developing ANOCA. However, most commonly it's going to be patients who are younger. Oftentimes they have less of the traditional cardiovascular risk factors that we talk about, and more commonly they're going to be women.
Okay. So that's something we all need to be aware of. But how does Hartford HealthCare's program for ANOCA really differ from other cardiovascular treatment programs?
So Hartford HealthCare, we've created this ANOCA program where we are giving patients a formalized consultation. They're going to get invasive top technology testing, both invasive and non-invasive testing, and they're going to get a diagnosis. But not only are they going to diagnosis, but with a collaboration of the experts within Hartford HealthCare, we're going to give recommendations to that patient's cardiologist to help them live, hopefully, a chest pain-free life.
And what are some of the key treatment options and approaches that are offered through Hartford HealthCare's ANOCA program?
Well, like I mentioned, we're going to be doing a really collaborative approach with the patient's primary cardiologist. They're going to undergo a lot of testing. And many of the treatment options include lifestyle changes, so exercise, weight loss, but include medications that are specific to what the diagnosis is, whether it be a microvascular spasm, a myocardial bridge, or a microvascular disease. We may recommend medications such as beta blockers, statins, calcium channel blockers, or even nitrates. So the care is going to be very individualized per the person and what diagnosis they have, what disease is underlying their chest pain.
Okay. Thank you so much for the information. I want to let everyone know that if you want to learn more, doctor, thank you for being here. HartfordHealthCare.org/services/heartvascular. All the information on your screen right now.